We recently completed a study evaluating the importance of social determinants of health in the risk of death after an acute coronary event. We observed that the lack of formal education and lack of employment were associated with a higher risk of death 1 year after an acute coronary event. Our study highlights the importance of screening for social determinants of health in patients with acute coronary events. My name is Sagar Dugani, and I'm a physician and assistant professor of medicine at Mayo Clinic in Rochester, Minnesota. I'm based in the Division of Hospital Internal Medicine and the Division of Healthcare Delivery Research in the Kern Center for Healthcare Delivery. We recently published an article in Mayo Clinic Proceedings, Innovations, Quality, and Outcomes titled Social Determinants of Health and Mortality After Premature and Non-Premature Acute Coronary Syndrome. We invite you to read our article in the journal. When we think of acute coronary events globally, there are two major challenges. One, there's a high burden of premature coronary events, which generally refers to coronary events in men 55 years or younger, and in women 65 years or younger. The Middle East has a very high burden of premature coronary events. A second challenge is understanding how social determinants of health affect outcomes after a coronary event. In our study, we addressed both challenges. We studied how social determinants of health affect 1 year mortality after an acute coronary event. We looked at 29 hospitals in 4 Middle Eastern countries. We found that following premature and non-premature coronary events, lack of formal education and lack of employment were associated with a higher risk of 1 year death. These factors also improved our ability to predict risk of 1 year death. As we think about how these findings help in our clinical practice, we observe that these findings highlight the importance of social determinants of health for risk of death after an acute coronary event. This knowledge helps us to identify patients who are at high risk of death and also guides our post-discharge care that we provide to patients. This study helps to identify disparities based on patient education and employment. For patients, it means that we may benefit from designing targeted interventions or providing closer follow-up after a hospital discharge. We want to provide the best possible care to patients so that they may continue to recover at home and get back to living longer and healthier lives. As we completed this study, we're focusing on the next step, which is understanding how education and employment affect the risk of death. We want to understand why patients have a higher risk of death and what interventions will reduce that risk. We want to design interventions that will reduce the risk of death and help patients live healthier and happier lives. Thank you.